So this is the part. Over here, this is the blood vessel. Okay, this is the blood vessel. And then we have different sites of administration, or sorry, metabolism. Different sites are there. And here we have it for excretion. Okay, so this is basically the GI tract, the blood vessel, the sites, the liver, and then after this, what we are going to do, we will be having, we will be excreting it through the kidney, right? So once the drug has came, the drug has came. Now your drug is in what form? It is a non-polar form. It is a non-polar form, right? Or we simply will say lipid soluble. Wait, we'll say lipid soluble. The drug is in lipid soluble form. What we have to do now, it is lipid soluble, so it got absorbed over here. Now again, what it will do, it will do its action. It has done its action on the site of action. Now the blood will ask liver, oh liver, can you please change me from non-polar or from lipid soluble, from lipid soluble to water soluble, please just change me. Then the liver will ask why you need to be changed into water soluble, so that I can get excreted easily, isn't it? So that I can get excreted easily through the kidney. Why? Because the drugs, because the drugs, when they are water soluble or when they are ionized, then only they get excreted very well. So keep this picture in your mind, what is happening when once the drug is getting absorbed in the lipid form. After the from lipid, now it is getting into water soluble. Now it has asked the liver, isn't it? What it has done, it has asked the liver to convert it. So this lever, now let's see the lever, what lever is doing. So this lever, we know we have a hepatocyte over here. So in the hepatocyte, what we have, let's suppose we have a nucleus over here, and of course an endoplasmic reticulum over here. Over here we have two enzymes. What are those two enzymes? They One is the microsomal enzymes, and the another one are the non-microsomal enzymes in the liver. Okay, so liver basically has two enzymes. What is it? One is the microsomal enzymes, and the another one is the non microsomal enzymes. Now why it is important, why we are discussing this part? Because this part will only let you know that how combinations of drugs are avoided and how the combinations of drugs are chosen. Okay, so see, let's suppose we have drug number 1, drug number A. Okay, this drug, or else A. Okay, this drug and a drug B. We have another drug B. So what happens, this microsomal enzyme, okay, when this, if let's suppose this drug is activating the microsomal enzyme, so what it will do, it will change this A into another form so that it gets excreted. But what if this B deactivates it, and now you are giving A also, and this A can be only metabolized by the microsomal and not the non-microsomal enzyme. Then what will happen? Because B has deactivated, now A can't be metabolized, so A will be remaining in the body itself. So while choosing the drugs, let's suppose that you gave A and B. Your patient said that, oh, I have fever, I have pain, I have diarrhea. So let's suppose you gave, for fever you gave a paracetamol, for diarrhea let's suppose you gave any of the antidiarrheal drug. Okay, then what will happen, let's suppose that this A has this B can be this B can be metabolized only by the microsomal enzymes. Okay, but this A has deactivated it. So what will happen, once the B won't act. Okay, so this is how we discuss and how we decide that which combinations should be given and which combinations should be not given. Because if one drug is getting metabolized by that particular enzyme, then there are another drug which are deactivating that. Okay, so this should be remember. So we have discussed about the three phases of how the drugs are metabolized. We discussed which combinations should be taken into picture so that the drug doesn't deactivate the enzyme in the liver. Now, what are the consequences of metabolism after this phase 2, and phase 3? What will happen after all of this? What is going to happen? Either the drug will be inactivated, okay, or the drug will be an active metabolite, or the drug will be an active drug itself, or the drug will become a toxic metabolite. Okay, so these are the consequences of the metabolism. Now let's see what are the factors that are going to modify this metabolism. We know definitely age is one of the factor that affects the metabolism, because what happens, let's suppose if I talk about children's and old age people, okay, what happens in them, metabolism is already reduced, it's less, then what will happen, toxicity will increase. Why? Because the drug is not getting metabolized, it won't be they won't be able to excrete it, and definitely the toxicity will be increased. The second part is diet. If let's suppose you are taking a protein deficient diet, then what will happen, if protein deficiency is there, then what will happen, the liver won't be able to make the albumin, liver won't be able to make other proteins which are going to bound the drug, and once the drug gets bounded, what happens, the active drugs are less, isn't it? And then definitely if it is acting, and then it can be obviously eliminated through other source, but if protein is less, then the metabolism is affected, because of which what will happen, definitely toxicity will be high, metabolism will be less. And if carbohydrate rich diet is there, then also the metabolism is reduced. And this is the reason why nowadays people are becoming crazy that we should take more protein and less carb, and eliminate the carb and take only protein diet. But it doesn't works like that. Okay, it can't be like all eliminating it, it's not possible to eliminate it completely. Now another thing is, any other disease, any disease which is there, it can also reduce the metabolism. So these are the factors that affect the metabolism. Okay, now the last, let's take an example of morphine, a drug morphine, how it is getting metabolized. Okay, so that it will give a whole picture of metabolism. So this morphine first go undergoes phase 1 of metabolism. How? Phase 1, what happens, it does functionalization. Phase 1, what happens, functionalization of morphine will be there. So either oxidation, because we know how many parts are there, total 5 parts are there. What are they? Oxidation, reduction, hydrolysis, cyclization, or decyclization is there, isn't it? So once it will be done, or either oxidation is done, or it will be demethylated, or blah blah blah, any of them. And then again, if it is not getting eliminated, it will undergo phase 2, and conjugation will be there, and there it converts into morphine 3 glucuronide or morphine 6 glucuronide. And you know what, morphine 3 glucuronide is an inactive drug, so it's very good that it's in inactive. But morphine 6 is a very potent analgesic. So here a important point is that once you are giving morphine, but after metabolism it is becoming more active, and now it is becoming more potent as an analgesic. So what we have to do, we have to eliminate it, isn't it? Once the action is completed, we need to eliminate it. So we will call glucosone to sorry, we will take this morphine, and we will tell what the P glycoprotein to take this morphine into bile or into urine, so that it can be excreted. So this was an example of a drug which can be get eliminated. Now we are at the last part of pharmacokinetics, and after this we will end this session. We'll be dealing with pharmacodynamics in the next session. Okay, so if I'm talking about excretion, let's be focused, because this is a very critical and a very interesting part of this topic, pharmacokinetics, and the last part. Okay, so we know where the excretion happens. We have a very beautiful organ which is doing the excretion for the body, and that is the kidney, isn't it? The kidney. So we know one kidney, what does kidney has? Kidney has nephrons. One kidney has 1 million nephrons. So what are nephrons? We know the structure, it looks like this. The glomerular nephritis is there, Then what we have, the PCT, the loop of Henle, the DCT, and the collecting tube. So this is the structure of whom, of the nephron. So this is the place where actually the excretion, yes, this is the place where actually the excretion happens, the excretion of the excretion happens. So this is the place where actually excretion about. So this renal